So I recommend this treatment option, as I've stated before, in men who have tried other modalities and failed, who want the spontaneity of having the implantable device that does not require them to take a pill and or do an injection prior to having intercourse, and people that want to have a definitive treatment for their erections. So during the procedure, we again make a surgical incision either above the penis or in the scrotum, which is typically my preferred method, and identify the corporal bodies that we are going to place the implant. We dilate and measure the size of these corporal bodies to select the appropriate size implant. And then if a inflatable is going to be placed, we select a side of the reservoir and place it through an inguinal ring, either on the left or right side, and place the pump in the scrotum itself. In the majority of my patients, I typically send them home the same day. This can be done in an ambulatory setting. Sometimes, if there is any concern for high risk of infection, for instance, let's say in a kidney transplant patient, for instance, then I would consider keeping them longer for antibiotics. In regards to clearances for surgery, I typically recommend people who have any prior risk factors at least get medical clearance. Oftentimes, patients have a lot of cardiac risk factors as well. That's why they developed erectile dysfunction in the first place, in which case I would need them to get cardiac clearance. If they are taking blood thinners, for instance, those are things that they would need to come off of and get cleared from their primary care doctor or their cardiologist to stop taking prior to surgery. Any pulmonary issues would also need clearance from a pulmonologist, for instance, and then other various clearances such as transplant surgery, for instance, would also need to be performed. For transportation to and from surgery, you are getting general anesthesia for this, and you are not able to drive yourself. So you will need transportation to the either hospital or surgery center, as well as from. In regards to preoperative instructions or what to do the day before surgery, typically I just have people thoroughly clean themselves. I don't recommend shaving. That actually has a higher risk of infection. So we typically do any shaving preoperatively ourselves. The reason being is if you do cut yourself, that can lead to an infection, and that would preclude us from placing an implant. So really just overall cleanliness is the simple answer, is typically all I recommend. In regards to medications to stop or change, obviously after the surgery, if you are taking erectile dysfunction medication, you will no longer need that. I mentioned before that any blood thinners, depending on which blood thinner you're taking, will need to be stopped at an appropriate time interval. Eliquis, for instance, is 2 days, Plavix is 5. And then any natural supplements, ginkgo biloba, for instance, can cause bleeding risk, so we have everyone stop those as well the week prior to surgery. Prior to surgery, the night before at midnight, you will not be able to eat or drink anything. This is because there is a risk of aspiration during anesthesia. There's the only really restrictions I recommend. Typically after surgery, you can have what you would like. I do recommend going easy the first day, particularly because anesthesia can cause nausea, but there are no restrictions per se after surgery. The only thing you need to bring with you the day of surgery is yourself, of course, and then any identification or insurance information, just in case there's any issues the day of surgery. Obviously bring a ride with you as well to take you home from surgery. Other than that, everything else is provided. So I do recommend against shaving the day prior to surgery. If you already shaven prior to seeing me, or this is something you do routinely, then I recommend you wait at least a week prior to surgery before you shave again. So the day of surgery, you will arrive at the time provided to you by the surgery center or hospital. The day before, they will call you and tell you what time to be there. When you arrive, you will check in. They will then get you changed to a surgical gown. An IV will be placed. They'll also give you a chlorhexidine bath, which is a cleansing wipe that we utilize. Additionally, IV antibiotics will be started preoperatively. This is to prevent the risk of infection during surgery. You will see me again. We will talk over any risks of the surgery again, as well as answer any questions you may have. And then you'll proceed to the surgical suite where the anesthesiologist or CRNA will provide anesthesia. They will also give you the opportunity to ask questions to them as well about any anesthetic issues or complications. Then after the surgery, you'll awaken in the recovery area. I will come talk to you again, and I will also talk to either your ride or family member that you've selected as your person as a point of contact to go over any issues or anything that we need to discuss after the surgery. You'll then be given a post-operative appointment and pain medications as well as antibiotics to go home with. You know, it's very common to be nervous prior to any surgical procedure. I would say that going into this procedure knowing all the risks, knowing your reasons for having it done, knowing that this is the appropriate treatment for you, I think these are things that can help mitigate the anxiousness or nervousness that can occur prior to a surgery. And then obviously being informed and watching this video, for instance, I think will help with those issues. So after leaving my office, I give everyone my card as well as my office number. And if you have questions before the surgery, I always encourage people to reach out to my office, and you can talk to me directly as well, even after I've seen you in clinic, and I can answer any further questions you have, absolutely.